This day in the life is over. Good morning. Welcome to a full day in the life of Dr. Paul. Alright. Little pot as I can. Just gotta leave some for my wife. Salt and pepper on the mix. Just gonna put that on there to speed it up a moment. Let's eat those babies. Oh, so cameraman needs some eggs?
Nope, I'm good.
Cameraman's good. Man, this guy comes prepared. Got enough to get started here. If you take a little bit off the top, it is strong.
True.
Well, we got to multitask. Part of my morning routine to check for important emails and the most recent literature. Sign up to various websites that provide information that interests me in the area of health, wellness, autism stuff. It's kind of one of my passions, is getting to the bottom of this whole autism epidemic. We all know somebody now who has a child with autism or on the spectrum or has some chronic health problem. And it wasn't like that when I was growing up, almost 60 years ago. I'm not pro or anti-Trump. I am hopeful, because of what he said, that we're going to get some real action in cleaning up the CDC and looking at the issues that are probably central to many of the health problems we face today. Chomp down on this breakfast here. Coffee to go.
Oh, you're just gonna start more for mom.
Mm-hmm.
Wicked smart.
Yeah, she does a lot for me, so if I can keep her happy.
Hey, thanks for coming back.
Yeah, of course.
Wouldn't you?
Most days, I get to start my day going to the hospital and seeing newborns. It's a really cool part of pediatrics. It is 7:14 in the morning. I happen to have two babies to see this morning. I think we're only going to show you one just because of the confidentiality part. And then it'll be off to the office. Oh, I should have brought you a badge.
Hi!
Hey, how you guys doing?
Great, how are you?
Awesome. So the nipple guard thing, I mean, there's times where you really have to have it.
Yeah.
Can I get you mad? Have you say, ah? There it is. Okay, so I think this one's gonna be okay.
Okay.
They call it a posterior tongue tie. That's the kind of latch you want, and she's
Yeah.
doing it.
Okay,
so I'll show you. I'll show you where I'm at.
Yeah.
So I'm up to there.
Oh, whoa.
my.
You see, and we started here.
Whoa.
Yeah.
And if you're on the end of your nipple, it hurts.
She's just talented at everything she does already. She can't help it.
That's a
She
proud
can't help
papa. Fortunately, babies are born with a lot of your immunity.
Okay.
So you guys were connected right till birth.
Right.
And a lot of the antibodies that you have in your body, everything
Okay.
that you are able to fight off,
Right.
your baby gets.
Oh.
Oh, I know.
I mean, even her cry is cute, though.
She's got a cute cry even.
Yeah.
I mean, you know, babies don't get much more perfect.
That's
what
see,
you were thinking.
he gets it. He gets it. Dr. Thomas gets it.
That's right. You're a super dad.
He
Yeah,
is beyond, yeah.
So your
I have
job
to
is
fight
to
her.
nurse,
Okay.
eat, drink, and sleep.
Yes.
So you got to take
God,
some
it's
naps.
like a dream
It's
job.
like that, yeah.
Thank
I can handle
you.
it.
Congratulations.
Thank you so
Thank
much,
you.
Doc.
This is so exciting.
One
So
of the
much
best
for getting out of
decisions we
bed
ever
early.
made was going to you as
Oh,
the
well, thank
pediatrician.
you.
Seriously,
Thank
we
you
are
so much.
We are so stoked.
So you just saw a newborn exam. I actually saw this family yesterday for their initial exam, so it was pretty quick and easy today. All right. Look at this stuff.
Can I get the
Suck it in. I actually don't eat this stuff.
burrito?
But we have great help here.
Yes.
Yes. This is for my videographer. I'm gonna run him hard today. It's 8:07. We're headed from the hospital to my office. right.
People just scrambling.
We're gonna be scrambling all day. So mostly.
I know who.
Well, here we are. I have arrived in Grand Central, my office. This is usually in person, but today I'm calling a prenatal. Hi, Marjorie, Dr. Paul Thomas. I am well, thank you. How are you? Sure, no problem. I understand there was a challenge for you to get in here.
Just say we're going in first patient of the day, and it's a med check.
First patient of the day.
I'm sorry, are you laughing?
No, I
Do you have
would
something to laugh
never.
about?
Stop.
First patient of the day, we're gonna have a med check. You'll see. Oh, look at those cool shoes. You know what you need? You need my socks.
Super fit, like he's got a cape on it, dude.
Is school hard?
Yeah.
Yeah. Now, I think we've had this conversation before. We know you're super, super smart. That's not the problem, right?
Yeah.
So when you take your medicine, like when you wake up in the morning, how do you feel?
Good, because I don't take my medicine right when I wake up.
So you feel better, and then after you take your medicine, you think you're feeling worse?
Yeah.
Would you agree with that assessment?
When he takes his medicine, he feels
He ends up feeling worse.
It just seems like he's really emotional. The Vyvanse was so good at the beginning. I mean, and then I noticed like they were complaining that he didn't want to do work. He didn't want to engage. He was laying on the floor in class crying.
The big two categories are, what natural things can we do that will help your brain? And is there a medication that would help, right?
Yeah.
If you're depressed or anxious, your serotonin is usually out of whack. We're also going to get levels of glutamate, which if those are high, you're anxious.
Yeah.
GABA is calming. We're also going to get levels of dopamine, norepinephrine, and epinephrine.
Okay.
These are your focus neurotransmitters. Epinephrine's your fight or flight. I'm sorry you're having a rough time. Be honest about how you're feeling. Because your mom can't guess. I mean, she has a better way of guessing, but I sure can't tell. Because you'd have a nice smile. So you give me that nice smile and I think, oh, he's feeling good. But if you're not, like if you're on the verge of tears, if you're just having a rough time, you can tell me. When you feel so frustrated and so discouraged and maybe so depressed that it just feels like life isn't worth living, right? You've had that feeling before. It's very good that you're telling people when you feel that way,
Yeah.
okay? There's nothing more important than, if that's truly how you feel, tell your mom, tell your dad, tell your therapist, tell your doctor, okay? When you have mood things and it feels hopeless, remember, it will change, right?
Everything changes.
Haven't you noticed that? You have good days and bad days? Yeah. But we want to make sure you have more good days and less bad days, okay? And I will work with you on that. All right. We'll see you in about a month. Sooner if need be.
Yeah. All right.
It's 9:15. We're going in for a healthy 2-month-old. Hello. Is that head kind of heavy? The weight's at the 75th percentile, so that's a beautiful trend there of weight gain. Are you gonna give me a smile? Are you gonna give me a smile? It's really hard to get smiles sometimes, isn't it? Hi, what you doing? You gonna make me work for it? You're really gonna make me work hard. There it is. There it is. I knew I could get a smile. As he lays here like this, he's looking across at over his right shoulder. I'm going to see if he can do the same on the other shoulder. Look over that way. Perfect. So here's smiling. At this particular moment, his right eye, it's more centered, and it's way off to the side on his left eye. You see that? He's starting, perhaps, this is most likely, to turn off one eye. Yeah, he's moving his tongue okay. Yes, you are. And eventually they start to push up and lift their head up, which will come. His head is just heavy.
It is.
It's like, because sometimes they'll see themselves in the mirror and then they'll kind of like go, oh, who's that? You know, who's that? Just, no, I'm just going to look to the side. For the viewers, if you have anything neurological whatsoever, and at this point I'm just going to call the vision neurological, but it's probably just a pure vision thing, you hold off on any further vaccines. You've got to sort out what's going on with your child neurologically before you put stress on the system. Thanks so much for letting us film.
This is your next patient. Always wanted to be on YouTube.
Really?
So excited.
Oh, really?
With the crowd.
Hello. Hey, how you guys doing?
Good, how are you?
Okay, what I'm seeing on this side is a pink dull, scarred up eardrum. So at this point, it's what we call a serous media, where you have some liquid behind those eardrums. What are we gonna do about this? You have any ideas? Can you count to 20 for me?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Good job. All right. If it's still this way in a month, then I think you gotta go see the ears, nose, and throat. So let's redo the hearing just for curiosity. So we'll play the hearing test game, okay? All right. Would you be willing to do a hearing screen? Sure. Okay. Cool.
What's that?
Not recording, right?
I am recording.
Right now?
Yeah.
You're doing it right now?
Yeah.
It's on?
It's on. What's the deal?
Nothing.
Lies!
Now what you're going to do is when you hear the beeps, I want you to raise your hand each time. When the beep goes, you hear the beep, raise your hand and then put it down, okay? Good job. Then put it down. Okay. There you go. So she heard all of them except for the last decibel, Dad, which I think is going to be pretty normal still, but I'll let Dr. Thomas know.
Good job.
She heard everything but the 500 hertz.
Okay.
In both ears, so I
Great.
told that that's probably still normal.
Not bad.
She heard everything else was great.
Okay.
Thanks, Nurse Erica.
You're welcome.
Okay, the hearing was good.
Thank
You
you.
did a good job. Thank
Say
you.
bye, YouTube.
All right. Nice shoes. See you guys later.
See ya.
Part of my day is, as you're witnessing, is seeing the kids. That's the fun part. Every job has its downside. I have to get on the computer and finish all my charting. I don't mind doing it as part of the job, but it's not my favorite. So I'm squeezing that in every moment I can between patients so I don't have this huge workload at the end of the day.
Oi! Old man! Oi! Old man!
You pipe down back there.
We've got people to save.
Strep still. So when was the last strep? Hello. Hi. How you doing?
How are you?
You coming along to help us out?
Yeah.
Are you coming to help us out? There you go. There's a good smile. All right. Is perfect. Take your tongue out and down. Nice. And that's a very red throat. All right. One more time. I'm sorry. We got a good swab there. So I just try to swab the tonsils, not the back of the throat, because otherwise you're gagging, folks. This is a backup culture here, and then the rapid just takes 10 minutes. We'll run that real quick and be right back. He's got a great smile.
He's good.
You're a good smiler. Yes, you are. Since you've seen me, I've seen a set of twins, and now I'm going to see another kid. Not everybody wants to be filmed, so we have to respect that.
You want to be filmed, don't you? You like it, don't you?
Hey, it's for the good of something.
For the kids.
It's for the kids. Hello.
All right.
Well, good thing you came in.
Oh,
It was strep. The question is, why is it positive when you were just treated,
yeah.
right? How does amoxicillin fail? Well, it's really rare for strep not to be sensitive to amoxicillin.
Okay.
So it's either that rare instance, like less than 5%, I think, where it's actually resistant, or more than likely, there are other bacteria in the back of the throat that are called beta-lactam producers, and they make the amoxicillin not work.
Oh, okay.
So we have to go with a slightly different antibiotic. I'm
Okay.
thinking of just going that direction. It'll cover all options.
Right, right.
And then get a new toothbrush, and we should be fine. So it's
Yoga?
just
Holy
6
flexible.
Not really.
What should we say to our YouTube fans about strep throat?
Honestly, it's not gonna hurt your throat for that long, but it will hurt for a few days.
Nice work.
Bye, guys.
All right. Hey, how you guys doing?
How are you?
Good.
Good.
All right. How you doing?
Good.
Good. You look good.
There was fishes out there.
There were fishies. Did you see the fishies in the waiting room? Like Nemo? Did you see Nemo?
I saw 2 Nemos.
2 Nemos.
After I was at home,
Mm-hmm.
I drank one hot chocolate bite, and it was too hot for me.
Was it too hot? Uh-huh. Just a little bit of redness. So that's how the ears are looking.
They want you to say that, Everly. Can you say ah?
Good. Say it again. Say a big ah. Hey. Good job. You did it. 10 minutes we'll know. If it's strep, well, you're going to have your backup script anyway. If it's strep positive, we're going to treat right away. Rapid strep.
Looks negative.
No strep.
Yay!
So that's good. I think we've got a slight ear infection. You got your script you can go get.
Okay.
We read one of your books, guys. The best bottom.
Who
The
has the best bottom?
book. Oh, okay. We have a book that's called that?
Best
You
bottom.
sure do.
I didn't know we had this book. So who do you think has the best bottom?
I just have ice cream.
Ice cream. I think that's a better idea.
I have ice cream.
They
Thanks
have
for
ice
watching
cream here.
Hey, how you doing?
Good, how are you?
You probably need a pair of those socks.
Sweet.
My stomach has been hurting on and off, and I've been coughing a lot since like last Tuesday.
He's got a perfect silent ah. Again. So for a school-age kid with a cough that's turning into bronchitis or what have you, that's a reasonable choice. I'll write you a script just because you're traveling.
Yeah.
Try not to use it.
Yeah.
Hello. Hi. Hi, Selena. How you doing? Oh, poor baby.
She has a fever and a cold.
You are warm.
Yeah.
Her ears.
Her ears are hurting? Okay. Good job. Yep. That's bright red.
There you go.
It is. That's red eardrum. See that?
Yeah.
Yeah. So
Oof, that's a very red
it's
eardrum.
very red, inflamed and irritated. We're just seeing a quarter of the eardrum because when I moved, that's
Yeah,
we're
yeah, yeah.
included with all that wax. But anyway.
Mira aquí.
Ah. So there they are. They're red. She's got a little bit of pink eye. I'm gonna wash my hands. So we're gonna give you an antibiotic by mouth for the ear infection.
Okay.
And some antibiotic drops for the eye infection. Because the infection that gets to the ear usually comes from the nose throat area. And the bacteria crawl up that little eustachian tube and say, oh, that's a nice place to have a shot. I mean, we were looking at this tip of her eardrum, right? Give me a high five. Good job. Well, folks, I'm a third of the way through my day. It's lunchtime. I'm going to go over to my addiction clinic. I'm a board certified addictionologist and I help young adults get off of opiates, typically heroin. That's where I'm headed, and we'll pick up after lunch. Fair start. So you're over here in my addiction clinic. We've got this nice big waiting room and a couple detox rooms. There we go, a little evening light. So I'll show you the other detox room. Simple, comfortable place. We've got a couch. Sometimes when you're in withdrawal, we'll cover you up with a blanket because you're just like, oh, it's miserable. But you know what? It doesn't take long if you come in enough withdrawal to have you feeling a whole lot better within an hour or two. And then you can start a new journey. And the goal is to get free of opioids. And you know, anybody who's struggling with addiction, when you're really in it and you can't stop, you're in bondage. We've got to address this on a much bigger scale, and I'm just doing my little part here at Fair Start.
Are you filming right now?
Mm-hmm.
Do you want to follow me and watch me do the UA? Yeah. That's weird.
So my patient here, in fact all our patients at Fair Start, one of the things we're helping them do is stay accountable and not use other substances of abuse. So we have a urinalysis cup, they call them urine drug screens, and very quickly this will analyze for most of the drugs of abuse that we see. We're talking about, you know, all forms of opiates, methadone, methamphetamine, amphetamine, MDMA, THC. This particular test does not include a sensitive alcohol screen, although we have the ability to get that on saliva, and we'll do that at times randomly. The value of this is our patients just know they have to be accountable, and those who are struggling will bring them in weekly, and so that there just isn't time to go out and be using and not have it show up in your urine. And once you're stable and you're doing well, we can see these patients once a month and very slowly taper off the opioids, and the plan being to be completely free of drugs of abuse.
Great success.
Yeah, it looks that way. So I turn it to the right until it clicks?
Yep.
Just a couple
Just
turns
about.
and it stops.
Till it stops.
Yeah. And then you just set in the usual spot. Perfect.
I actually graduate today.
Oh, from your program?
Yeah.
Awesome. So you have a
Already
good
paid.
plan
Yeah.
in place. Awesome. It's better than you look better than you've looked in a long time.
Yeah.
Yeah.
I feel,
Feel better?
I
Yeah.
have,
So
Overheard. What's your
Up to
new
you.
living arrangement going to be?
Oxford House.
Okay.
Close enough to my sponsor, my home group, and my girlfriend and kids.
Nice. Most of them are great. And every once in a while there's a really rotten one because of who's in it. If there's stuff going on there where they're letting people use but stay, if it's not right
Yeah.
and it's going to risk your sobriety,
Yeah.
right, it's not worth it.
Yeah.
Are you still trying to quit smoking?
Yeah, and the
Nice.
patches have helped a ton.
Good.
I've only smoked like one cigarette in the last 3 days.
Nice. There's a real benefit to just staying in the middle of the process. You know, the 12-step program is not for everybody, but if you can get benefit from it, you're leaps and bounds ahead of most people.
Yeah. Yeah.
You know, the thing about life is good things happen and bad things happen. Guaranteed, right?
Yeah.
Even when you get, you know, we get our life all figured out and we're clean and sober and everything's going great and your relationships are going great. As they say, shit happens, right?
Yeah,
Right?
then you have a bad day.
And you have a really bad day. And in the old days, our response was to reach for our drug of choice.
Yeah.
Right? Man, I can't handle this. Bam. We need a different response. And having the 12-step program in your pocket and being kind of involved,
Yeah.
oh man, I need to get to a meeting, right?
Yeah.
I need to call my sponsor. I need to call my friend Joe, Charlie, whoever, right?
Yeah.
You keep a list of good people that you know are plugged in, and yeah. Your chances of long-term success go way, way up. Yeah.
That's what it seems like. Sometimes I'll get the thought, like, man, today would be a good day to get away with using something like that. But it's
Yeah.
more like the criminal element, like
Yeah.
the getting away with something,
Right.
the thrill-seeking behavior.
Yeah.
The physical craving, like I need that, hasn't been there for a while.
Perfect. The tool we use in this program, the buprenorphine, it's a partial agonist. I know you know this is partly for the viewers.
Yeah.
It's like you're giving a half opiate effect, and then the other half of the medication is actually blocking the rest of the receptors.
Yeah.
So at your dose, as long as you take that 16 milligrams, I don't want you to go out and experiment and use. I don't think you're even there, right?
Yeah.
But if you were to use on that dose, it doesn't even have any effect.
Yeah.
Because it blocks all the receptors.
Yeah.
It also handles that craving to the point where, as you pointed out, you don't even have a desire to try to go use.
No.
Other than we learn, and you probably learned this in treatment, avoiding your triggers.
Yeah.
Right? So
It's given me an opportunity to work on those triggers.
those, yeah.
You know, because I'll still find those same stressful situations and just frustration and not getting what I want and having to deal with things that I don't want to deal with. And since the option to get loaded isn't really there,
right.
I have to find a different way, and that's what
outlet.
I've been able to do.
Good
and that's
for you.
what it has given me the chance to do.
Yeah.
Every day I take
That's
it,
good.
I get another chance to keep growing.
Yeah. Thanks, man. I'll go
Thank
work
you.
on your prescriptions, and thanks for letting us share this as part of my day. Not too many pediatricians who are board-certified pediatrics and board-certified addictionologists.
When I tell people I'm going to, my doctor's a pediatrician for Suboxone, they're like,
what? This disease has hit my family to some extent, and so that's why I got involved, and I want to be of some help. The positive lines are negative for all those substances, and this here is positive for buprenorphine, which we want that to be the case, because that's the medication we're taking. Wrapping up at Fair Start, and going to take a quick lunch break. We'll see you this afternoon. It's almost 2 o'clock. Time to start the afternoon. Hi! Hey, Rex! How long have you been coughing?
Can't remember.
A couple days. Oh, interesting. Again? So what I'm hearing sounds like this.
That is funny.
Here's what it's supposed to sound like.
Yeah,
So you're squeaky. So you guys have the allergy thing going on, and hopefully, hopefully he's not allergic to you.
yeah.
So you're allergic to dogs. You're allergic to cats. you're allergic to grasses, and then you get sick. Bam,
Yeah.
you're wheezing. And some people live so close to the threshold of wheezing that any little thing tips them over, and I think that's this
That's
guy.
what he is.
When air goes down these airways, these little tiny muscles that are around the bronchioles, the tiniest airways, they spasm when you're exposed to what you're allergic to.
Yeah.
And pollens, dust, pets, mold, pollution, cold air, being sick, colder viruses. Nobody should smoke in the house.
Yeah,
And for
we
some
know that.
people, exercise will trigger wheezing. Those are the most common things. When you're in spasm for more than a day, you start to get inflammation. So you get a lot of mucus in there.
Yeah.
And that's why a person who's coughing and wheezing, it can sound like you're infected.
Right,
Because there's just so much inflammation and mucus.
right.
And so the albuterol relaxes that muscle, but you need an inhaled steroid to get rid of that inflammation.
Okay.
What's he doing?
What's Moon doing? You say hi, brother.
And that'll be for 30 days to 60. Ready to fly? Jump hard. Whoa! You flew up there like Peter Pan. Ah, there you go. You see that line where it's red above and white below?
Yeah.
That is a layer of pus
Ugh.
behind the eardrum.
Gross. You got
see
pus
that?
behind her ear.
Yeah.
Yeah.
So that's okay. That's no big deal. Alright, so it's quite red. That's an old ear infection that's on the way out. Yeah, you're a good guy. High five. Nice. So they now sell these things. They're about $40, $50. They're little portable pulse oximeters.
Yeah.
And you stick your finger in there and you just hit the start button. And if you hold still, it'll pick up your heart rate and measure your oxygen.
Which is much better than sitting there counting his
So
breaths.
yeah, so my oxygenation is at 99. My heart rate's at 72.
Mom,
And it might be a cool
you
tool to
gotta
have.
float,
Then you'll know when
right?
he's in trouble. 12, 14. Take it out.
Oh wow, that's crazy.
That's not right.
That's not normal.
That's not right. How you guys doing?
Good, how are you?
Doing great. Good to see you, buddy. We've had you on Concerta methylphenidate?
Yes.
Yeah. Do you sometimes forget? I probably would. It's hard to remember every day.
Need some help.
And so on those days that you forget, what's school like those days compared to when you...
School's a little bit harder on those days
Okay.
when I forget to do
Okay,
stuff.
this is definitely helping. Your height is average. You see that line there? Blue. Probably eating a good breakfast, hopefully. Yeah? Sometimes? Maybe?
I've practiced in the past.
You're right about
Is
that.
that what you have every day?
At mom's.
Wow.
I always like to remind those of us who struggle with focus, I do too, so I understand. Our job is to just try hard, right? And then your dad, your mom, your doctor, our job is to help support you with structure. If medication is helpful, we support you with medication. There are sometimes some supplements you can take. Vitamin D, we all need more D. A B complex is usually a good idea. High dose fish oil is usually a good idea.
Okay.
And so those are just things to think about just to support your brain. Because if you're really low in D or you're really low in omega-3s and the Bs, that can affect brain. As we get bigger, you're becoming a teenager, you're going to hit your growth spurt if you haven't started already. And some people need more medication just because your body mass is going up. And some people actually outgrow their need for the medication. So we'll just have to watch that, okay? We don't want to increase side effects, but we want to keep having you getting the benefit that you've been getting. So anyway, there's nothing wrong with your brain. We just want the connections to happen, right? I find that those who can get off of it do so by creating structure. This decision that you got to make every day now that you're in middle school, high school, college, to drink or do drugs or not. Especially if you have ADD or focus issues, just tell them you're allergic. And if you can stay away, just keep making that right choice, you're going to have a great future. It's like, oh, that's all it takes? It's all it takes. Try hard, take your meds, take your supplements, and just say no to drugs and alcohol. And then we'll see you in 6 months.
Perfect.
Perfect.
Whoa, whoa.
Whoa.
Oh, I get a high five too.
High five. You were amazing.
I'm almost a hugger, so.
Oh, you want one too?
Cameraman.
Cameraman was great.
Can't tell you guys are related at all.
No. Go do this. Yeah, she gave it to me. I've got the box. After you use utensils, you put them in a box so they're not laying around loose. Oh, hi. How you guys doing?
Thomas. Good. How
Look at your outfit.
Who are you being?
Iron Man. So tell me, what happened here with your hand?
Well, I was trying to open an Audi pop,
Okay.
and it was frozen, so it slipped off and then went into
Wow.
my skin.
So is that just one stitch? Is that all that's
Well, they
left?
told us there's 2.
So what we look for with cuts and after you've sutured them is to make sure they're not infected. So you feel for heat. It doesn't really feel warm to me. And you look for redness spreading out from the wound. That looks okay. So I think it's time to get those out. What I'm going to do here is, this is just a little grabber thing. So this is just going to grab this little guy.
So hold very still, Lily.
See? It just grabs it.
Are those the little scissors?
Those are the little scissors.
Those are tiny.
Those scissors
Oh my goodness.
That one's out.
So I was on my sister's bed and I was trying to jump on to my bed from her bed, but I bumped into the corner of her dress and then bled.
That darn dresser got in the way, didn't it?
And there was a lot of blood.
So we'll just get that on there for you. So no flying through the air for at least another week. Okay?
Say
High
thank you,
five.
Dr. Thomas.
Okay.
Because she was turning blue yesterday.
Gotcha. I asked them to bring them in. The day is getting late. All right. Hi. How you doing?
I'm smiling.
Yeah, you've had a lot going on, I hear.
Yes.
Yeah. I'm going to take a listen. Yeah.
Oh no.
You can still watch respirations when she's calm.
Yeah.
And if it's consistently over 60 breaths per minute, we may have to check. We may have to check the oxygen, but we did, and it's perfect.
Okay.
Right? I just wanted to make sure heart and lungs sounded good, and they do. So hang in there.
Alrighty.
RSV is one of those nuisance illnesses. There's nothing you can do but hydrate. Okay. We'll see you later. Bye bye. You did a good job. There's the smile. Boy, I had to work for that one. What you looking up, Dr. O? Hey, how you guys doing? That is something other than eczema.
We thought maybe it was what Ben had, the molecular.
Molluscum contagiosum. That's exactly what that is. It's a wart virus. And left to its own devices, it'll go away usually in a 2-year, 3-year period. It's completely harmless. Oh, you got a blue tube in there. Good job. They've got little raised bumps. They've got little kind of you almost get the sense they're solid.
Using the hydrocortisone once in a while when it gets really worse.
Yes! Good job! And it's actually our immune system interacting with the virus that ends up knocking them out. So you don't have to treat them all. You just have to treat some. Yeah. All right. It's always good to see you guys.
Left bounces.
It's 5 o'clock. We get a 1-hour break, and then it's back for the urgent care. What do you say, partner? Sushi time?
I think sushi would make sense at this point.
I think it's sushi time.
It's 5 o'clock. It's quitting time.
Yay! I thought I was done. I have to show you this baby. So cute. Hi. Hi. Look at that smile. You are just too adorable. Da-da-da. There we go. Say ah. Yay. She's so expressive.
Cute family.
Oh. Take care.
The man just doesn't stop. We were supposed to get sushi like 10 minutes ago. We've been going since 6 a.m. And he literally may as well be skipping down the halls.
I'm hungry. You hungry? let's go eat. Restart this journey. We're gonna go get some dinner. We got 45 minutes to grab a bite. So, 7 years ago after I opened Integrative Pediatrics, I thought, this town needs a pediatric urgent care. I might as well do it. So I opened Pediatric Urgent Care, first pediatric dedicated only urgent care in the Portland area, I think in Oregon. Problem is, not everybody wants to work those hours, evenings and weekends. Since I own it, if I can't get it covered, I work it. But it's not forever. Someday, someday, over the rainbow. Okay. Let's go get some juice. Here, I'll put a top on it for you.
Oh, thank you.
You guys have a lovely evening.
You too. Thanks,
Thanks.
Lance.
Enjoy the sunshine.
Fresh squeezed juice, which, by the way, is the only kind of juice you should drink. Guys, it's urgent care. It's my third business. I've got Integrative Pediatrics. We did Fair Start over lunch, and every evening from 6 to 9, it's Pediatric Urgent Care. Welcome to Phase 3 in the day in the life. So, first patient for urgent care is not my patient. Would have been a fun one. We've got to go flush some goopy wax. A 2-year-old with an earful of goopy wax. First patient of the night.
Be brave.
Okay, whoa. How you doing, buddy? Super good. Superboy's
good.
doing super good. I like it.
He's been having accidents left
Oh.
and right.
Poop or pee?
Pee.
Just
It's,
wedding accidents during the day.
Yes, during the day.
How many times a day would you say?
I'd say at least 3 or 4 times a day. And
Is there any new stress in his life? This is the super light that looks in your super ears. I'll be gentle. Perfect. One great super ear. Look at and ta-da, ta-da. That's good. Tummy's good. Tickle, tickle, tummy. Okay, let's try to collect the urine.
You think it's a bladder infection?
I doubt it. Boys just don't get bladder infections that often. So I suspect it has something to do around the, I'm getting all this extra attention when I have to go to the bathroom or have an accident. Just a hunch, but we'll see. I don't know if I hope I'm wrong or not. We'll just see. Knock, knock. Oh, yes! You're back! Good job. Sorry about that.
That's the good stuff.
That's really yellow.
That's where the money happens.
That's right. So we'll know in about 10 minutes if this is strep or not.
You want to see this crazy setup? I've got strep, urine, and I'm going to do it all at the same time. Multitask, yo.
Yep. Own it. What are you doing here?
I'm dipping the urine.
Yeah, that's normal. Specific gravity of 10-15 and a pH of 7 and everything else is perfect. Alright. Your urine is perfect. Did he go outside? Nope. He's not there. Where could he have gone?
Sly one.
Oh, I see you hiding back there. This is him having an accident. You saw my reaction. It was like nothing. But yeah, we're good.
Say bye.
Bye.
Positive strep here, kids.
How do we know it's positive, Nurse Alex?
We got
Two
the 2
strips.
lines. Our staff here at Integrative Pediatrics get excited when we figure things out. Well, guess what? You have strep. You will feel a lot better in 18 to 24 hours. I recommend no school tomorrow. Thanks a lot, man. Got enough. It's getting late in the evening. It's almost 8 o'clock at night. We started at 6 this morning.
Show did.
We sure did. We got a very interesting rash to go take a look at. Hello. So you have something going on. What's going on? When did this rash start?
Just today.
Just today? You woke up with it?
Mm-hmm.
Okay. So what we have here, that's a classic location for what we call eczema, dry skin. See right there? That's like classic hives.
Oh.
Yeah. Do you have trouble swallowing?
Sometimes.
This is a test. See if you can drink water. Glug, glug, glug. You did it. High five. Ah, good. She's swallowing fine. This, folks, is classic hives. We want to make sure she's not wheezing, which she wasn't. We want to make sure that she's not having trouble swallowing, which she wasn't. The most likely causes are either the viral illness you had before this or some artificial dye in those jelly beans. So what are you going to give her tonight?
Benadryl.
Or?
Claritin?
Perfect. All right.
You can see my face in the mirror, see?
I do. I can see it. Just about 9 and the last one just walked in. I'm off to see the last one of the day. Hi.
What does it sound like, Alex?
No.
Hey, everyone quiet.
I'll get out of the chart so you can finish.
I tooted and you spoke through it.
You tooted?
Cut. Nice work.
I'm working hard, okay?
Nice work, Andrea. Got to get my couple moments of shine for this day in the life video I'm producing for Dr. Paul, the rest of the squad.
Whew, that was a day. Now, my days aren't all that long, but a lot of them are. When I was an intern, we would do 36-hour shifts. You'd wake up in the morning, work through the night, and the next day. They were brutal.
What awaits you?
You know, we started this day in the dark, and we're ending this day in the dark.
Yep.
Signing out. This day in the life is over. However, I want to thank all of you who've been watching this far. You made it to the end. Thank you very much. And just about every one of these wonderful kids or young adults who were in this video, you're going to get to see their entire episode. They'll come out one a week for the next couple months. Thanks for watching. That was a 16-hour day, folks. Big shout out to my producer and son, Big No-No.